Right. Alrighty. So, thank you for joining me this evening, everybody, and giving up your evenings as you also usually do. This was a hotly requested webinar from a lot of you wanting to know about selective mutism. And disclaimer here, this is not one of my massively hot topics clinically. So I've had to go away and do a lot of research on this as well, which has been really useful for me actually, and quite timely, which is something I'll come to a little later. Um, so we're kind of all learning about this together in a sense. It's something that we are trained on at university, but if you don't go into it, then it's not something that you'll often encounter. So let's have a little look and see where we're at. So apologies if you are somebody who comes to this every time, but the Zoom housekeeping rules, cameras on or off, I really don't mind. It's evening time and some of us just want to be snuggled up in our hoodies and relaxing. But please do keep yourselves on mute at all times unless you're contributing to the Q&A at the end, just so I don't hear any confidential household or setting specific conversations. Any questions, type them into the chat box. If you're worried that you are going to forget the question by the time I get to the end of the presentation, pop it in the chat box and I'll have a little look at them at the end. Do come and go as you need. We may have children at home, pets at home, cups of tea, what have you. Please do, come and go as you need. And all the slides will be emailed to you. So again, you don't need to make copious notes and it will all go up on YouTube if you want to watch it again. As you probably all know by now, these webinars are hosted by your Reach Out Stronger Practice Hub team, Damon, Vic, Jess and Lisa, and we have Damon and Lisa on with us this evening. Stronger Practice Hubs have been commissioned by the Department for Education to support early year settings to improve their outcomes across the early years foundation stage, not just communication and language, but literacy, maths, all the areas that you guys work with. Our Stronger Practice Hub is based at the Barn Nursery School in Grinster Green, and there are 18 Stronger Practice Hubs across the UK. The Early Years Evidence Store is something that is available online for all early years practitioners, wherever you are in your career. And it has the latest evidence relating to practice across the early years foundation stage. So again, communication, language, maths, literacy, play, all of those things are covered there. So if you are a new practitioner and you're wanting more information, it's ideal. If you are a more experienced practitioner and you perhaps just want to check that what you're doing is current evidence-based practice, pop on there as well. There's lots and lots of things for you to find to keep your practice as good as it can be. The hub also offers bespoke support. So if you're thinking, I can't quite find anything on this particular thing that I need, or I've got a particular cohort of children that are challenging me, or I'd like some advice on this particular thing, get in touch with the Stronger Practice Hub and they'll be able to put a package together for you, all fully funded, to support your particular setting, because it's not a one size fits all, is it, in terms of setting or children? So, and we appreciate that. So follow us on social media. You'll be able to find out all of the local sort of childminder and early years events, conferences that we're running as well. So let's get on with why you're here this evening. So selective mutism. First thing is you may hear it referred to also as situational mutism. And I think actually that's probably a little bit more descriptive of the condition. So situational or selective mutism affects around about 1 in 140 children. So, we can presuppose that there'll be, at least 1, 2, 3 in a primary school setting. Now, it's a common misconception that selective mutism is a speech and language delay or disorder, and it's not. It's actually an anxiety or mental health based disorder, and we'll come into the reasons for that a little bit later. So children with selective mutism will speak absolutely fluently in some situations, but stay consistently silent in others. And that is why it's not a speech and language delay per se, because actually children's speech and language is fine when they are feeling confident and safe enough to be using it. But there are situations where anxiety overrides that and they're unable to talk in particular situations. This may or may not be accompanied by, a kind of physical manifestation. So they may freeze, they may give you a completely blank expression, or they may not. They may be able to engage non-verbally. And at the beginning, I said this was timely. So because I'm not busy enough, I'm also a rainbows leader for little 4 to 7-year-olds. And we've just started a rainbow who does have selective mutism and doesn't talk while she's at sessions. But she is very able to sort of nod or shake her head or give me a thumbs up or a thumbs down. It's not a complete freeze. So for some children there will be, and for others they'll still be able to use non-verbal communications. Now, this is more prevalent in girls and multilingual families. So again, you're more likely to see girls with selective mutism, although not exclusively. It used to be linked to stubbornness. So, a while ago, children with selective mutism were just sort of given a fairly bad rap, really, by just being told, they're stubborn and they're just not talking. But now we know that actually it's a deep-seated anxiety disorder. So how do we go about diagnosing? What's the criteria for diagnosis for selective mutism? So a child will not speak in specific situations, such as school, or even if they just can be overheard in public. In situations where the child feels comfortable, they will speak normally. So very often when they're at home with their parents, perhaps their grandparents' house, they will be able to speak completely normally with no sign of any delay or disorder. It's only in those certain situations where they stop. Now, this needs to have lasted for at least a month or 2 months in a new setting. So if a child is predisposed already to selective mutism and we pop them in a new setting, it's very unlikely that they're going to talk. But what we need to see is a duration of a couple of months in that new setting. This inability to speak in particular settings needs to interfere with their ability to function. So it needs to have an impact, and that's something that we're looking at. And the inability to speak it's not better explained by another behavioural disorder or mental health issue or communication disorder. So what we're looking at is for everything else to be relatively intact, we're just not talking in certain situations. So there's some quite big impacts of selective mutism, and early intervention really is key. So in early year settings, we may witness things like increased accidents or urinary tract infections because a child just isn't able to advocate for their own toileting needs. You may see avoidance of eating and drinking so that they don't need to go to the toilet. And in the long term, if we don't address this early and kind of raise the alarm that this is something that we're suspecting, you'll see children enter school not doing their best in class for fear of being asked to read out or present their work in class. They may have difficulty with homework because they haven't been able to ask for clarification about the content of the task or what they're supposed to do or when it's going to be handed in. And teenagers might not develop the independence that they hope, or that we hope as their parents that they will, because they can't leave the house unaided because they're too anxious to talk. Something that's really important to note on a safeguarding level is that selective mutism can sometimes be an effect of PTSD, so post-traumatic stress disorder. So we really need to be thinking on a safeguarding level. if a child suddenly stops talking in an environment where they were previously happy to do so, we need to be thinking quite carefully as to why that may be. So it may be something as relatively simple as they've had an altercation with another child and they don't feel confident in that setting, or it could be something a lot bigger that's causing their anxiety. So I think if you have a concern that a child suddenly stops talking in your setting and you can't really work out why, I think it's the diligent thing to do to go through your local safeguarding procedure and to seek some help on that, to be better safe than sorry. So I want to think about strategies in the setting. If you know you have a child who has selective mutism, really choose your words very carefully. And I've talked about this in my neurodiversity webinars where, children aren't speaking, but my goodness me, they can hear you. So perhaps avoid things if you're talking about a child in your setting are Bethany is our selective mute. Bethany doesn't like to talk. Bethany doesn't talk here. She doesn't talk to adults. She doesn't talk, so don't expect anything from her. That kind of thing. I would hope that that wouldn't happen anyway, but you've got to be very sensitive around it, remembering that it is an anxiety issue and that children with selective mutism will be understanding because they haven't got any underlying speech and language delay. Instead, we need to get a little bit more creative and spin it more positively. Thinking about saying things like, Bethany talks really well at home and we're helping her to find her confidence here. Bethany likes to tell us things in a different way, and that's okay. Bethany will point or nod or, whatever strategy she uses to tell us what she wants, or we know that Bethany will find a way to let us know what she needs. So really affirming that Bethany, in this case, can communicate her needs and will communicate her needs just in a different way. And then that's absolutely acceptable within this setting and that there is no pressure to talk. Repeating a child's favourite activities is absolutely key. So we all know that children who feel safe and secure in their environment are more confident, more likely to learn, and ultimately more likely to talk. And I'm not talking within a week or two. This can be a very, very, very slow burn. But repetition of fun, favourite activities really will relax a child. We really need to change our thinking from speech and language on this one to anxiety management and thinking what will make a child feel the most relaxed. We need to welcome other ways to communicate. Now, other ways of communicating are called AAC in the speech and language therapy world, which stands for alternative and augmentative communication, which basically just means other ways we can supplement our communication other than talking. So you have things like unaided AAC, which are things like gestures, sign, Makaton, facial expressions, body language, maybe vocalizations, but probably not in this case. Or aided AAC, for which you need something. So it may be low tech, like pictures, objects, photos, written words, or high tech, which might be iPad apps or your kind of computer speech generation devices. Now, I have worked with a child who did use an iPad for selective mutism. So it is something that we do get to at some point. But I think in the setting, if you do have a child, it sends a very strong message to them if they are selectively mute. If you kind of take other communication to them because they feel accepted and they feel validated and they feel that actually people are okay with that. And it sends a very strong message of acceptance, which feeds into that confidence, which feeds into that likelihood to talk. And actually looking at this slide, when I put this talk together, I've decided that the next webinar next month will be all about different types of AAC. So if you're kind of looking at that thinking, crikey, there looks like a good few ideas there, but I've got no idea how I might go about implementing that. Come back next month and we'll have a look. So I thought I'd look at a couple of things that you could maybe do in your setting. And I think self-registering is a really, really good way of making your registration for the day an activity where it's not crucial to talk. And I think as well, all of these things, if you take them as a whole room or a whole setting approach, again, it doesn't single anybody out, does it? So these are really, really nice ways that perhaps you can think about children self-registering themselves every day. Could even just be they put their photo in a box or something just to independently register themselves without having to talk. Home visits are so useful if you have a child who's selectively mute. They may not talk while you're there, and that's okay. But what you will get a feel for is, are there any particular things that they enjoy playing with? Are there any particular rooms that they enjoy being in? What are the things that really settle them at home? And how much of that can be transferable to my setting? Now, this book is kind of our absolute Bible for selective mutism. And it's something that, all speech and language therapists will have a look at while we're training. And it's still going now. It's been around forever. And what's lovely about this is that there is a super, super section on do's and don'ts in a preschool setting. So what I'm going to do is stop sharing the PowerPoint now and go through that with you. Rather than reinventing the wheel, I thought we should just kind of go through the section of the book that is publicly available. So when you get your slides, if you follow this link, you will be able to find this chapter. Okay, and it's just bullet points. And while I'm here as well, if you see here, Smira are your go-to website in terms of learning a little bit more about selective mutism. So do's and don'ts at pre and primary school. So again, we're thinking very much about your preschool setting here. So the biggest do, and the one take-home message from tonight, if you take home nothing else, is that selective mutism is all rooted in anxiety. It is not a speech and language delay or disorder as such. So it's a real phobia of talking, and we can only overcome that in teeny tiny baby steps. Pressure to speak will just make things worse. Even what you feel is a very gentle encouragement, like, oh, would you like to tell me that? Will be seen as a child as a direct request to talk. So please try not to do that. Physical activity, craft work, creative work are all really, really good because they're not primarily focused on speaking in the same way as maybe reading a book or playing a particular game are. You can sit side by side with a child and make a picture together. You can sit side by side with a child and do some crafting together. And actually, you can take the pressure to talk away. You can comment, by all means, have a little chat about what you're doing, comment on what the child is doing. But there is no need for the child to talk for that activity to be successful. And they're the kind of activities that you need to focus on. So again, in the next point, it says talk to the child about what you're doing without expecting an answer. So making comments. So, instead of going, oh, what's the name of your dog? You can go, this looks like your dog, but I can't remember his name. Again, because that can be taken by a child as, well, she can't remember her name. And that's that, rather than a direct question that needs a direct answer. Lots of pausing to give the child the opportunity to speak without the expectation to do so. Any gesture or whisper should be rewarded by just a really natural, warm response. So going back to My Little Rainbow, so she will give a thumbs up or a thumbs down to indicate some. We just make sure that we give her a lot of yes, no questions or statements if we need to ask her anything. And we just sort of respond, yeah, fine, no pressure at all. At the register, we'll say her name, she'll just nod and we'll go, yeah, fine. We don't make a big thing of it, just keep it really normal. There may be children in setting who that child will talk to. And by all means, go through them sometimes. Remembering that it's an anxiety disorder, we need very much to reassure that child that we're not going to pick on them. Okay, even though they're only tiny and only 2, 3, or 4 years old, we need to be going, I won't choose you to talk, don't worry. Making it explicit will go a very, very long way. Just say, have a great time while you're here. If you want to laugh, if you want to sing, you can. If you want to talk, you can. But if you don't, it's absolutely fine. Give that child permission to be who they are, how they are. If anything is upsetting them, you can invite them to find another way to tell you, perhaps have some pictures ready. And, just try and keep everything very, 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 very calm. Make sure you do include the child by offering alternative communication. For example, if you are singing a particular song that takes turns, they could maybe hold up a picture of the word or the particular line that they're singing. And actively support friendships as well. Puppets are good, masks are good, voice activated toys are good, and always make sure that the child can access the toilet, meals, drinks, and everything without speaking. Okay. And if they're old enough, if they're a slightly older child, so preschool, talk them through it, because remember, they will be able to understand you. So the what not to do is don't take it personally. I think as caregivers, I think we want all the children to like us, and it can sometimes feel like, what am I doing wrong that this child doesn't feel secure enough with me and my setting to talk? But don't take that frame of mind, because I think you'll just spend a lot of time being upset. So you need to separate it from being a thing about you, because it likely isn't. Don't confuse the fixed facial expression that you may get with a kind of defiance or a glare or a boredom. It won't be that. It will be an anxiety face. Try not to beg or bribe or persuade a child to speak, okay? Do not make it your mission to get them to talk, okay? Your main role in this is to keep a child happy, safe, secure, and be building their confidence, okay? Don't make the child say hello, please, thank you. We need to think about the use of please and thank you in more general terms, I think. Please and thank you don't really hold any true content. It's just manners to keep the grown-ups happy. So actually, we really need to think about the onus being on useful content rather than manners content. Again, as we've said, don't ask direct questions. Don't look directly at the child in a kind of, come on, speak, speak, speak. I'm willing you to speak. That again adds pressure. Even if you're not asking them explicitly to talk, children know that that's exactly what you're wanting them to do. Don't penalize a child for not talking or say, oh, you're being too quiet. And also don't react when the child does speak. Even though you want to hang out the bunting and put some party poppers out and, shout it from the rooftops, play it down. Keep it extremely normal and natural, and just respond as you would with any other child. Don't ask the child to repeat themselves. Don't tell the child off in public. again, just keeping in mind it's an anxiety driven presentation. But also, don't treat the child too delicately either. You know, they're probably going to enjoy banter the same as everybody else. Certainly, my rainbow loves a good little giggle. Um, just we just don't expect her to talk her way through it, but we can see when she's enjoying jokes. Um, Equally, don't give any special treatment. Don't anticipate their every need. Um, I think again, there can be a temptation to communicate for the child. What we need to do is find other ways for the child to communicate, rather than communicating for them. Um, So really, oh, the other one is not don't doing surprises. Don't do surprises because they won't on the child. That may not go well either. And also don't allow the child to become isolated. And the final thing is really don't dwell on what the child doesn't do or can't do. Okay, let them shine in another way. Okay. And any of you who've been to any of my neurodiversity webinars or conferences, you'll remember that clip I showed of using strengths-based rather than deficit-based approaches. And with these children, it's especially important to focus on their strengths, because the more we focus on their strengths, the more confident they're going to feel, the more assured they're going to feel, and the better that long-term outcome will be. So don't forget, this is all available to you online. So you don't have to copy it all out. It's all just there and you can cascade and share with your settings. So I'll just go back to the end of the presentation. And if you did want to have a look at the book, this is the book. It's about £60, I think, and it is written for speech and language therapists. So I maybe would just stick to what's available online. But it's there if you want to, if your local library has a copy, you know, it might be worth having a little look. The other excellent resource here is that may be a little bit more relevant to you guys working in early years is supporting quiet children, exciting activities to help reluctant talkers become confident talkers. So firstly, a little bit more affordable. And secondly, it's written by Maggie Johnson, who I believe, yeah, is the same person who wrote the Selective Mutism manual. So it's a little bit more kind of the practical aspects from that manual. So that's very, very worth having a little look at. So that brings us towards the end of the selective mutism theory. Coming up in December, I know we're all in that massive run up to Christmas, but if you can make it, there's going to be a session, as I say, on that alternative and augmentative communication. So if you are working with a child with selective mutism, or actually with any speech and language and communication need, where you're thinking, might visuals help? Which ones should I use? Which ones might work well in my setting? Come along to that, and I'll be going through all the different types of AAC that may work with your early years children. So that's on the 4th of December, and the repeat will be on the 10th of December. So that's the end of the teaching part of the webinar, as usual. At which point I think we stop the recording to allow a kind of safe space for asking any questions. I kept seeing a few bits and bobs going in the yeah, okay. So there's a few things in the chat which I will have a little look at now. So the little one I had, Alison, was bilingual and a girl. Okay, there we are. Mum is a paediatrician, so I wasn't concerned. The child would only talk with me and mum, but no other family member, and she wouldn't speak at nursery at all, not a word. Yeah, so that's a very common presentation for a child with selective mutism. Is there a typical age for selective mutism, or does it depend on lots of other things that you've already mentioned? Yeah, Barbara, great question. We tend to see it when they're younger, I think, usually. Anxiety can often present slightly differently in the older children. So I think it's common. I think really, if it's common enough that lots of you have asked for a webinar on selective mutism, we can definitely assume that there's a lot happening with little ones who are younger. But I don't think I don't think there's a typical age as such, but we're certainly seeing it in younger children now. Um, Kirsty, when's the repeat? Next Tuesday. Um, Strengths and interests always. Katie, can I tell you about Selective Mutism by Maggie Johnson was useful? Yes, that's an excellent one, Katie, that I'd forgotten about. Yes, so there's a book called Can I Tell You About Selective Mutism, which is also by Maggie Johnson. So Maggie Johnson is like the absolute guru of selective mutism. And that's a slightly more accessible one as well. So I think the one that I showed you in the talk really is your kind of practicalities for in your setting. But can I tell you about selective mutism is a more booky, but more accessible than the selective mutism manual.